Hey, thanks for clicking. You're about to learn why you don't need to panic about coronavirus. Alright, pitter patter, let's get at her. Nearly all patients hospitalized had chronic health conditions, study finds. Only 6% of patients at one New York area health system had no chronic health conditions. Hypertension, obesity, and diabetes were common. New study of thousands of hospitalized coronavirus patients at the epicenter of the outbreak in the United States of New York area has found that 88% of those coronavirus patients had at least 2 chronic health conditions. So that's point number 1. Second point, most people likely didn't know they had the virus, or even if they have it, because they are asymptomatic. It doesn't affect a lot of people that negatively. They might not even know they had it, and the symptoms are very minor. That's why estimates of infected populations keep going up and the known severity of COVID-19 keeps going down. According to researchers in Iceland, 50% of positive coronavirus cases were asymptomatic. One of the pieces of information that we have confirmed now is that a significant number of individuals that are infected actually remain asymptomatic. That may be as many as 25%, Redfield said. Then a few days later, researchers in Iceland reported that 50% of their novel coronavirus cases who tested positive had no symptoms. Okay, so here we go. 50% of their known test positives were asymptomatic. How many are out in the population that are unaccounted for? Now they're starting to do forced testing, and what I don't like about it is, listen, we've been fed a lie, and we're going to go into point 3 here shortly. If you're asymptomatic, you're out there, and they've made it seem as though you're spreading it everywhere you go, like Johnny Appleseed, spreading death everywhere. Just, you don't touch anything, don't look at anything, don't even breathe, because you're just spreading COVID, and you're killing the elderly, you terrible human being, you. Here's the issue. It's created on a false premise. As we go into point number 3, the whole idea around the asymptomatic spread, we're going to debunk right now. Part 3, debunking asymptomatic spread coronavirus. Here we go. CBC article. Medical journal report that a woman without symptoms spread the coronavirus in Germany was wrong. Okay? The whole premise of need to quarantine, asymptomatic spread, lockdown. This was the premise this was written on. It was wrong. That's why this matters. Okay, so it's been a controversial question ever since a case report in the New England Journal of Medicine last week claimed that a woman who was asymptomatic triggered a chain of infections near Munich. Surprising observation, because coronaviruses are believed to be spread primarily by people who are already sick through droplets generated by coughing and sneezing. The original report said the woman did not show symptoms until later. During her stay, she had been well with no signs or symptoms of infections, but had come ill on her flight back to China, the authors wrote. But the report was published in one of the most prestigious medical journals in the world and immediately raised questions about how to manage people exposed to the virus. Do we lock down? Do we quarantine? And the answer was yes, because asymptomatic spread. And they didn't. Coronaviruses are very spreadable, so asymptomatic coronavirus, they in panic. The report, though, was wrong. The case study was based on faulty information because the original authors, guys, listen to this, did not speak directly to the patient, according to a news report in the Journal of Science. Okay? It's just nuts. So, here's the article. Here we go. Chinese researchers had previously suggested asymptomatic people might transmit the virus but had not presented clear-cut evidence. There's no doubt after reading the NEJM paper that asymptomatic transmission is occurring. Anthony Fauci, director of the U.S. National Institute of Allergy and Infectious Diseases, told journalists. This study lays that question to rest. But now it turns out that information was wrong. The Robert Koch Institute, RKI, the German government's public health agency, has written a letter to NEJM to set the record straight, even though it was not involved in the paper. The letter in NEJM described a cluster of infections that began after a businesswoman from Shanghai visited a company near Munich on the 20th and 21st of January, where she had a meeting with the first of 4 people who later fell ill. Crucially, she wasn't sick at the time. During her stay, she had been well, with no signs or symptoms of infection but had become ill on her flight back to China, the authors wrote. The fact that asymptomatic persons are potential sources of the 2019 COVID infection may warrant a reassessment of transmission dynamics of the current outbreak. But the researchers, it hurts to read this. It's still going on. That the researchers didn't actually speak to the woman before they published the paper. The last author, Michael Holtscher, of the Ludwig Maximilian University of Munich Medical Center, says the paper relied on information from the 4 other patients. They told us the patient from China did not appear to have any symptoms. Afterward, however, RKI and the Health Food Safety Authority of the state of Bavaria did talk to the Shanghai patient on the phone, and it turned out she did have symptoms while in Germany. According to people familiar with the call, she felt tired, suffered from muscle pain, and took paracetamol, a fever-lowering medication. An RKI spokesperson would only confirm to science that the woman had symptoms. Here we go. Let's break this down for a second. Debunking asymptomatic spread. Put on your mask. Can't go anywhere. We need to lock everything down. Hurt our economy. Hurt our future. Because if we don't, we're spreading it everywhere and hurting everyone. We don't want to hurt the most vulnerable, so let's lock everything down. All based on this. Okay? False report. They didn't follow up properly. We're going to break this down. Here it is. They asked the 4 people that were around the lady that later fell ill, the Chinese businesswoman who was in Munich on business. They asked them, did she have symptoms? And they said no. And they said, good enough for me. All right, put out the article, boys. And boys and girls like that, we need to get the information out. We couldn't immediately reach, their excuse was they couldn't immediately reach out to the Chinese businesswoman for comment. And it was too important, the information, so they put it out. Okay? They finally talked to the woman. And here we go. They told us the patient did not appear to have any symptoms, but here it is. According to people familiar with the call, she felt tired, suffered from muscle pain, was taking a fever-lowering medication. So one can only assume that she has symptoms. And for those of you saying, it doesn't matter. We're starting to get back to normal. Things are getting back to normal. So, this is all old information. It doesn't matter anymore. Wrong. You're just wrong. CBC News. Mask must be worn in Guelph or Wellington County, medical officer of health says. Commercial establishments must prohibit people from entering if they're not wearing masks. There are exceptions to the rule. It does not apply to children under the age of 2, people who, when wearing a mask, find it prohibits their ability to breathe, people with a medical reason for not wearing a mask. So you might have a way out if you have a medical reason or you're under the age of 2, but basically this line, people who, when wearing a mask, find it prohibits their ability to breathe. So now you're being asked to justify why you're not wearing the mask if you choose not to. And this is where the issue is. What is it based on? It was based on a false premise that asymptomatic spread was occurring based on a Chinese woman that went to Munich and spread it to 4 other people. And then we already debunked this. We checked up on her and she did have symptoms. So the only way you're spreading coronavirus asymptomatically, if you had it, is maybe you're on a 20-hour flight with recycled air. That might be a possibility. Outside of that, maybe, you work in an office in a cubicle that's a prison-like setting. Shoulder to shoulder, breathing on each other. And 8-10-hour days, you might spread it then. Outside of that, I don't think you need to wear a mask based on what we know. Coronaviruses are spread primarily through droplets, and that's when you're coughing and sneezing and things like that, when you're symptomatic, not when you're asymptomatic. And we need to call this out for what it is. The premise was wrong. That we shut down based on this premise. That asymptomatic spread. Everything needs to shut down so we can protect the most vulnerable. Why? Because if you're asymptomatic, you could be spreading it. We can't discriminate. Shut everyone in. Shut everything down. Only the essential can work. Based on a false study. They followed up. Wrong. She had symptoms. So now belongs with you, the listener. Share it, spread it, get the information out. You've seen it with your own two eyes. You can go, CBC News covered it even. The mainstream media covered it. And it's been brushed aside, buried under a mountain of other news, opinions, and narratives that support the current lockdown. But you won't hear about this one again. I promise you that.